Welcome to the RAN Mutual Assurance Medical Service Provider Information Briefing. In this video, we will discuss medical treatment guidelines and procedures to follow when treating a RMA beneficiary. RAN Mutual Assurance is the administrator of choice for occupational injuries and diseases, as well as for non-work-related health and insurance benefits for the mining, iron, steel, metals, and other related industry sectors. RMA is not a medical aid, but an assurance company which delivers compensation for work-related injuries and diseases as described in the Compensation for Occupational Injuries and Diseases Act 130 of 1993. RMA provides for a range of benefits beyond medical compensation, which arise as a result of an employee's injury or disease which was contracted as a result of their occupation. The RMA claims cycle proceeds as follows. When an employee has an accident at work or contracts an occupational disease, they receive medical attention immediately and report the condition to their supervisor as soon as possible. The employer then reports the claim to RMA within 7 days, where it will be captured and registered by an RMA administrator who assigns a claim number to the case. The medical service provider must submit the first medical report to the patient's employer within 14 days of the diagnosis. If the patient's treatment is ongoing, the medical service provider must submit progress medical reports every 30 days. When the patient's condition has stabilized, the medical service provider must submit a final medical report to RMA. Should the employee suffer a permanent disability, RMA will award compensation in terms of the COID Act. Employers must ensure that the accident documentation accompanies the patient to the hospital. RMA will provide the employer with the claim number, who will advise the medical service provider of the number. RMA requires the submission of medical reports which are complete and contain accurate clinical observations. Extensive explanations of medical processes and assessments, as opposed to brief mentions of seeing a patient, set the standard for these medical reports. Reports which do not adhere to these standards create administrative delays and errors, which may lead to RMA not being able to compensate employees for their medical expenses. In some instances, for example, in the case of a minor injury consultation, the medical service provider will be able to supply the first and final medical reports at the same time. Please note that RMA will not pay any additional fee to a medical practitioner for the completion and furnishing of any medical report in accordance with Section 74 of the COID Act. In order to admit and treat patients, the medical service provider must obtain the following details to be completed on the medical reports to follow. From patients, a copy of the accident report, the employer's full details, all details relating to the accident, all details of the employee, for example, the company number and industry number, and finally, all personal details of the employee, such as the ID number and the patient's full names. From RMA, the medical service provider must confirm that the accident has been reported, that RMA has accepted liability for the accident, and most importantly, the RMA claim number and the RMA pre-authorization number, when applicable, must be noted and filled in on all the medical reports. This information will also be used during the medical service provider's invoicing. Having the complete and correct information will ensure that RMA is able to process claims quickly and efficiently. Medical reports are also required to confirm that patients are treated for or booked off due to legitimate medical circumstances. Should RMA discover that such ethics have been breached, we will have to request that the monies paid towards this treatment be returned to us. Guidelines for handling invoicing and treatment of a patient depends on the nature of the treatment. RMA has divided treatment into 3 categories, namely acute, subacute, and further treatment. Acute treatment immediately follows the accident and requires the medical service provider to stabilize the injuries sustained. If it is reasonable and in the case of a medical emergency, acute treatment does not require pre-authorization. However, authorization is recommended. RMA will require pre-authorizations for further consultations for MRI and CT investigations. Subacute treatment refers to a case which has been finalized, but within 24 months, the patient will require additional medical treatment. With such cases, RMA reserves the right to liaise with the medical service provider to confirm merits of the proposed treatment or to discuss possible alternatives. According to the COID Act, treatment has a lifespan of a maximum of 24 months. Additional surgical investigation must be authorized by RMA and treatment must relate directly to the injury sustained or disease contracted. Hospitals must request written authorization prior to a patient's admission to guarantee payment. Further treatment occurs when medical treatment continues 2 years following the date of the accident. In most cases, further treatment is required when it becomes evident that further treatment for an occupational injury or disease is indicated to improve the condition. The condition must be as a result of the occupational injury sustained or disease contracted while on duty, which RMA is liable for in terms of the COID Act. The medical service provider must submit a written motivation to RMA for consideration and a written authorization number must be obtained from RMA before treatment starts. Pre-authorization for elective surgery must be submitted at least 1 week in advance, as RMA requires time to review and approve the authorization. RMA views the scales of tariff rates under the COID Act as a guideline for maximum fees. We authorize medical treatment on agreed rates for any further treatment continuing 24 months after the accident occurred and subject to maximum fees gazetted. Whether medication prescribed to the patient is acute or chronic, RMA expects that the cost of the medication be reasonable and the period of repeat acceptable. To ensure that costs are kept acceptable, RMA requests and promotes generic alternatives where possible. Please also note that a maximum of 6 months' supply of chronic medicine may be supplied at a time. Correctly submitted invoices ensure that RMA is able to promptly pay medical service providers for their required fees. The following information must appear on all invoices submitted to RMA for payment: the RMA claim number, full first names and surname of the patient, correct ID number for the patient, the company, industry and employee numbers, the name of the employer, the date of the accident, the medical service provider's practice name and VAT registration number, all service dates, service tariff codes, the amount claimed per line item, RMA's pre-authorization number, attached copies of all documentation relating to charges, and finally, the ICD-10 classification and description. Invoices can also be submitted electronically. This ensures that all documentation is in one location, leaving no invoice lost in postage. Online submissions also provide a quicker turnaround time, as receipts are awarded instantly and processing claims will take less time. The RMA Medical Portal is a self-help tool which you can use to log onto the system and search for RMA claim numbers, the status of a claim, and query any medical invoices and their status. In order to gain access to the portal, RMA's IT department will issue a username and password, following the completion of a registration form which an RMA representative will provide. Hospitals must electronically submit invoices directly to a switching house that will interface to MSO. MSO has no settlement powers. They will forward the medical invoice to RMA following evaluation against authorization given on reasonable medical costs. MSO assesses these medical invoices for validity and correctiveness. Doctors and other practices must also submit to a switching house who will interface directly to RMA. Medical service providers may submit to the switching house of their choice. This concludes RAN Mutual Assurance's Medical Service Provider Information session. For any queries or assistance, please call our contact center on 0860 222 132.